Hey everybody, welcome back to my channel and welcome back to episode number 5 of my VCP and Me series. So in today's video, this is part 2 of my VCP Explained series of videos where I interview Dr. Virginia Kimonis. And Dr. Kimonis is going to answer several questions. In today's video, we're going to talk about who found the VCP mutation. Are there any treatments on the horizon for VCP disease? And can VCP patients exercise? And is it possible for VCP patients to rebuild muscle? Dr. Kimonis is a professor with the Department of Pediatrics in the Division of Genetics and Genomic Medicine at the University of California, Irvine. She is very involved in the VCP community and is on the medical advisory board of Cure VCP Disease, Inc. Who discovered the VCP mutation?
So it was my lab. I was a clinical geneticist at Springfield, Illinois, and at the Southern Illinois University School of Medicine. And a family attended regularly at the MDA clinic there in Springfield, run by Dr.
Mm-hmm.
David Gelber. And he referred the family to me. And I remember seeing four members of the family in a 1 hour appointment, but then I
Mm-hmm.
realized this was a big family, and I had never seen any report in the literature of the combination of the muscle disease. It was a limb girdle muscular dystrophy that it was
Mm-hmm.
characterized as, with Paget bone disease, and then there were some individuals who had dementia. And the myth then was that only the women got dementia. So I had learned the tools of how to identify genes because I had just finished my fellowship at the National Institute of Health. And so I started going to their barbecues, their burgoo parties, their family gathering
Mm-hmm.
parks, and started collecting DNA and doing a quick examination on them. And that's the way we with the help of linkage studies. You look for markers that reside along the genome, and you see if the person who has a particular marker also has the family disease that points to where the gene might be. And you need recombinations of the chromosome to then get close to the gene, because chromosomes, when they are passed on from a parent, undergo recombination. So
Mm-hmm.
typically a chromosome that you inherit from a parent is a mixture of both that individual's parents because of
Yeah.
the crossovers. And these crossovers occur randomly. And so it's a lot of work to try and get to
Mm-hmm.
the smallest region where the gene prevails, and then you have to go and sequence all the genes in that region. And in those days, it was very tedious work to sequence a gene, and there were many genes in that narrowest region that we got to. There's 85 genes, and there was no way my lab could do it all.
Mm.
So we engaged collaborators. I had two other collaborators, one of whom was Dr. Darvish at the HIBM Institute. So he has himself another type of hereditary inclusion body myopathy, which is recessive.
Mm.
And then my colleague, Steve Mum from WashU, so he works on bone disease. So our three labs divvied up the genes, and I was very lucky that our lab actually identified VCP. And then you have to prove that it's VCP, and every person who had the muscle disease was found to carry the mutation. And
Mm-hmm.
there were people, however, who we knew carry the mutation who were not symptomatic, and those individuals are called carriers. And then, people who are at an advanced age who don't manifest the disease, that they probably didn't inherit the gene, and we proved that those individuals didn't carry the gene. So there was a lot of detailed work within the families that needed to be done, and in many families, to prove that VCP was the gene. And then you have to do functional studies. So we made an animal model which showed the phenotype that patients did, which we then published and have used even to this day to do various translational studies looking at the effects of potential treatments that might modify the pathogenesis of the disease.
So that leads me to one of my next questions here. So are there any treatments on the horizon for VCP disease?
So we have studied VCP inhibitors in our lab after Dr. Mingo's work in the Drosophila that she generated with the VCP mutation. She showed benefits of a VCP inhibitor. These were early inhibitors that she tried, which were not really suitable for patient treatment. The company Cleve were very generous and actually have been very collaborative and have provided us the knowledge and the drug to treat cells as well as a mouse model. They were using this drug to treat cancers, and they treated 85 patients, and generally it was safe in those patients, but there were concerns about vision effects. So there is an enzyme called PDE6, which is what's affected in Viagra, and that does affect vision, color vision in particular. But those patients typically recovered once the drug was stopped. That was the reason why the FDA has not given them permission to, has not approved this drug. And what the FDA has requested is a lot of preclinical work spanning 6 months in 2 different animal models, which gets very expensive. And that's what's needed to be done. So we've studied this drug in our lab, and it has been shown to be beneficial in the cells as well as our mouse model. We've received funding from the Muscular Dystrophy Association and the NIH to study this. We're also looking at other drugs in our lab. Other labs have studied different mechanisms and different drugs. For instance, Dr. Linda Greensmith in London has studied the effects of Arimoclomol, which is a drug that is good for relieving stress in the cells. And she worked with Paul Taylor's VCP mouse model. It's an overexpressed mouse model, and studied the E232E mutant mouse, which is a very severe mutation and causes more disease in the mouse model, and showed that it was beneficial treating these mice with the Arimoclomol. The drug has not been approved yet. The company Orphazyme has been working with other diseases such as Niemann-Pick, Gaucher. These are lysosomal disorders, in addition to neuromuscular disorders such as ALS and sporadic IBM. So that data has been partially published, but there are ongoing studies which will clarify its benefit in those disorders. But they are confident that the drug will be approved, and that's a potential also for VCP, since it was so beneficial in the VCP animal model.
Well, that's outstanding. So it sounds like there's hope.
Oh, absolutely, there is hope. And then there are many other researchers working on disorders that are related to VCP disease. We heard a very nice presentation by Don Cleveland at the MDA conference last week where he was modifying statin to try and improve the pathology in ALS.
Hmm.
We don't know if that's a um, mechanism that's affected in VCP disease, but that's work that needs to be done moving forward. Yeah, there are other ways to knock down a gene, and our lab is exploring that. But
Can VCP patients exercise?
exercising is really valuable. So exercise is also something that has to be carefully monitored because people have harmed themselves by overdoing exercise. So it should be done um, with a plan, with supervision, with gradual increase of the amount of resistance that people use, and repetitive movements with small weights are better than going all out, lifting heavy weights, which are going to be harmful to the muscle and cause injury, which then sets people back.
Yeah, that's something that I've learned because I was a cyclist. I would ride my bike a lot, and I kind of had to change things up when I got my diagnosis because I thought the more I cycled, the more it would increase my strength, like it would in a normal person. But when I was told that my muscles would only get worse with exercise, or rigorous exercise, I had to change, and I got an e-bike. So I still ride my bike, but I have one that is pedal assist and has a throttle so that if my muscles start hurting, I can just use the throttle to get home. So I don't have those permanent effects. My understanding is our muscles, they don't recover like they would normally, is because of the VCP gene and the proteins.
Mhm.
Your cells, when your cells can't clean themselves out after an intense workout, they can't recover or recycle, they die, and your muscles slowly die, and that's a problem.
Yeah, no, it is a problem. So overdoing it definitely is bad. And then, resistance training, aerobic training is really good, but resistance training sort of builds up the muscle, but it has to be done with small weights, repeated often.
Mhm.
So
So VCP patients can still do resistance training. Can VCP patients rebuild muscle at all?
so that's the purpose of doing resistance training, that you should be able to, at least prevent further destruction of muscle cells. The study has to be done, however. Nobody has done the study.
Mhm.
We um, received a great score from the NIH, but eventually it didn't get funded. And you know, I believe that that study should be done and should be moved forward again. So that was part two of my VCP Explained interview with Dr. Kimonis. In my next video, part three, we're going to be talking about diet tips, the right to try law, and how it impacts, or if it impacts, VCP disease research. Any CRISPR, can CRISPR help with VCP, and VCP's impact on having a family, along with the impact of COVID 19 and are VCP patients at higher risk of COVID 19 and its effects. And then going to wrap up with some final thoughts by Dr. Kimonis. Thanks for watching, and look forward to the next video. Thank you.